interested in the fetal origins of psychiatric disorders. And what has been acknowledged more and more is that it's really the very early environment and as early as the intrauterine environment that plays a fundamental role in determining disease susceptibility in an individual. And this has been supported, for example, by studies showing that maternal infection and inflammation during pregnancy actually increase the risk for psychopathology like schizophrenia, but also autism in the offspring. And what we are really interested in is what might be some of the biological determinants, so biological alterations during pregnancy that might be modifiable by interventions that program the fetal brain. We do this by recruiting women in very early pregnancy at the late first trimester and follow them up serially over the course of gestation to get measures of stress biology. So we're looking into inflammatory markers, so immune mediators that are elevated under conditions of infection, but also under conditions of stress, for example. We start assessing the infants right after birth. What we see is really the result of the prenatal environment and interaction, of course, with genetic susceptibility, and not yet confounded by postnatal influences. So we obtain an MRI scan shortly after birth, and we look at brain anatomy, but also structural and functional connectivity. And then we follow up the children further and do another MRI scan at 12 months and at 24 months of age to look at developmental trajectories. And then we also try to get a good estimate of the quality of the postnatal environment, which will also affect brain development because the brain stays highly plastic after birth as well, of course. Specifically, what we focused on was maternal interleukin-6 concentrations during pregnancy. This is a pro-inflammatory cytokine, an immune mediator that's, as I said, is elevated under conditions of infection and inflammation, but also under conditions of maternal obesity, for example, and also under conditions of maternal stress, which are all conditions that have been associated to an increased risk for psychopathology in the offspring. So we, for the first time, measured directly interleukin-6 in pregnant women and then related it to newborn brain maturity. And what we focused on in the newborn brain was functional connectivity. So we obtained a resting state fMRI scan. So basically what we're doing is we're looking at activity in the newborn's brain. We are scanning them during natural sleep, and we're looking at which brain regions are active together. We are looking for synchronized activity. Two brain regions are active together, there must be some connection so they can talk to each other. So it's really based on the principle what wires together fires together. So we can really think about some of those conditions that we know can influence interleukin-6 concentrations during pregnancy, maternal depression, maternal stress, and maybe think of some multimodal interventions that affect these conditions and hopefully normalize interleukin-6 concentrations because it seems to affect fetal brain development. We still need to learn more about what kind of conditions during pregnancy actually are associated with alterations in interleukin-6 concentrations, and then to see whether if we modify those conditions, we also modify interleukin-6 concentrations. I don't think we are at the point where we would even want to start thinking about any kind of pharmacological intervention, because interleukin-6 is critically important for normal brain development as well. So we definitely wouldn't want to block it. So we still have to learn much more about what are levels where there seems to really be adverse outcomes on the fetal brain. And until then, I think one should start targeting those conditions in the mother that have been shown to be elevated with interleukin-6 concentrations during pregnancy.